name of the Father, Son, and of the Holy Spirit. Amen. Hail Mary,
full of grace, the Lord is with you. Blessed are you amongst women, and blessed is the fruit of your womb, Jesus. Holy Mary, Mother of God, pray for us sinners, now and the hour of our death. Amen.
Lovely people of God, I welcome you once more to Catholic Digest. In today's episode, we will continue with the interview with Archbishop Gabriel Charles Palmer Bakel, Vice President of the Ghana Catholic Bishops' Conference and the Metropolitan Archbishop of Cape Coast. The interview will focus on COVID-19 and its related issues. Stay tuned for more.
By obeying the number 4,
which one is that?
People who are to stay at home are also saying that some of them are hungry. Some of them are suffering. They have children. They have to feed them. What will you say about it? And I know that the government is trying his best. And the church also is trying. But what can you say concretely whereby it will bring hope to those people?
You know, the Catholic Church is all over the country. Yeah. We have health facilities all over the country. We have parishes all over the country. And we have set up in any of our parishes Caritas. And Caritas's duty is to do what we call the taking care of the poor, the needy, and the vulnerable. So every parish we have set up COVID risk emergency management over there. So I know that, you know, parishes have gone donating soap to hospitals and clinics. Dioceses have gone donating masks, PPEs, and hand sanitizers to, you know, health facilities and the rest of it. I know that many parishes have gone donating food. I'm aware, for instance, that in Accra, Christ the King is still taking care of the people in the streets, giving them food. See, so while government is doing what government can do, providing for them, I like to beg our people. It is true that I hear government is taking care of about 400,000 vulnerable people. But the numbers that are appearing at the places of distribution, you wonder whether all of them are really vulnerable. And this is where our Christian faith comes in. We should not be greedy. We should not go, you know, just as if it's an opportunity for us to hoard, to get and to eat. I feel very sad. I said it in one interview that because of the coronavirus and the restrictions, people are hiking up their prices, selling them higher than they should. Where an olonka of Gari is now costing people 30 cedis instead of 7. I mean, when you do that to the poor, Jesus says, whatsoever you do to the least of my brothers, you do unto me. I beg those who are doing that, please stop it. Let us learn to share. The fact that government is now paying water for the people and the rest of it. This is not the time to misuse water and misuse electricity, because these things can get finished. I was told that somebody said, yes, now government is going to pay the water, so bucket of water, chua on himself, bucket of water, chua on themselves and the rest. As if, you know, please, 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 for God's sake, we shouldn't be doing that. The water belongs to all of us. Electricity belongs to all of us. And what we have, we must cherish. We must, you know, economize it, because there are harder times that are going to come. So, brother, this is what I would say. The church is supplementing it. I like to use the opportunity to commend the doctors, to commend the nurses, the frontline workers who are trying hard to take care of our brothers and our sisters who are already sick and those who have COVID and are coming for help. All these places are where we bring our PPEs, personal protection, you know, equipment to. We bring our sanitizers to. We bring soap donation to, and the rest of it. So you see, the Catholic Church is really side by side complementing what government is doing. But the people who are hungry, Let us take care of the truly poor and the needy, and not those who think they can be Kwaku Anansi, a bit too clever. I believe there is a silver lining to any and every cloud. This COVID-19, which has happened and which is causing so much suffering and pain, should bring the best out of us. And that is where I come to the media and I beg the media, please, media men and media women, emphasize the heroic deeds that are happening. There are many people, doctors and nurses, who are really sacrificing themselves according to the teachings of Christ, wherever they are. And we should focus on these nurses, these doctors. We should focus on these health personnel. We should focus on the security service personnel, 98% of whom are doing what they can to make sure this disease does not go out. We must commend, for instance, government officials whose duty it is to give us the rules and the regulations and to apply them, the protocols. We must emphasize goodness. This is the time. Then the other side, I would like us to look at whatever is being done and emphasize the better part, the goodness out of it. It is a pity. One policeman may lose his temper, or one soldier may lose his or her temper because of the indiscipline, the way we behave. And because of that, then we condemn all the security services and the rest. One or the other government official, overwhelmed by too much work, may make a statement. Then the media will go scrutinizing that statement to the point of destroying the 99% goodness that has happened. So I want to beg my media brothers and sisters, this is the time to let the world hear the positive information. COVID-19 is not a death sentence. When it happens that somebody has it, the person should not be stigmatized. It is not a death sentence. So I just want to say, yes, let us emphasize the fact that COVID-19 is not a death sentence. No sickness is a death sentence. I hear the government also is deciding to quarantine some people in some of our schools in order for them to do examination and see whether they are really sick, and then take care of them in the centers where they can be taken care of. People are up in arms, not in our town, not in our village, not in our schools, not in where should they take them? They are our brothers and our sisters, am I right? Imagine that the doctors would say, oh, because of COVID-19 and how dangerous it is, I am not going to work. Nurses say, we are not going to work. And there is. If you have a brother or a sister who is suffering, who is to take care of them? So the time has come for us to make some sacrifice. I was happy to read in one of the newspapers, Jerry John Rawlings. He said, this is the time for us to make sacrifice, sacrifice, sacrifice. So I would emphasize, please, Ghanaians, fellow Ghanaians, this is the time for us to make sacrifice. Brother, I think if you say it in Ewe, what are the 5 points, then I will give the blessing.
That's Sicily, Nyakata, Nyasenyebe, Alaba Dololosia, Mafa Aglonule Nyanchiwa, Nyasro Asikoklo, Nyaklo Nyafasio, Ple Ajale, Alaba Adi, Evelia. Nyakata jebe amachia osinade asime yemi glona be hand sanitizer alo yelo kwara asimo kwa la kpobe akpetefo enusesema elema kala kpobe etoyima la ko atutu asi alebe wade nugbegle de siadeda ye etolia mi kpobe yelebe ya fonuklo novio alo mi kli nyawonana Yakobe yoda yofo abomeve lavame alebe ya bomeve vama efiabe mi fufuo temi le zozom le dume mi le nu flefe yim tefe sia tefe lela ejebe mama la no mi adome ye novio mi ado aja abo la no mi ame nenema ke ga globe mi akata mi kpota ku ya wo kole fo ngoti hem alebe plefe nu ye lebi ya fonu klamade alo ya dogoa ejebe la ko ahenu imede amoko de kome efiabe la ko henu alebe ye eta alo le wɔnana le be adogolo ma mele nɔvio gbɔ yi ge o ke bom la nɔ wo ŋutɔ wo gbɔ ye ewu nua wo mianɔ aƒe me ame sia ame nenɔ aƒe me miado gbe ɖa miatsɔ gbedodo ɖa miaƒe nunɔla gã le gbɔgblɔ na mi Archbishop Boke le gbɔgblɔ na be miado gbe ɖa edzi be xɔsetɔ ɖe sia ɖa gbedodo ɖa ye nyu nu si wɔna aʋa na mi aʋa ya wɔ mi la Kristo ƒe aʋawɔwɔa me nuƒoƒo za kple tɔ ke bom gbedodo ɖa.
Brother, let me say something in my mother tongue.
Okay, good. Nzima.
Mediema. Kakala mel kamu yejuna. Bese ewure bi ega mo kakala. Okundeke oba sekchi ye mani. Owoke ye mu eti ye bomade no sanke ewure okundeke oba sokweye. Na so oba azokwe wa owoke edoye ekindem oba ana edoye edie na efai ke yevure mo wa na osuo no yevure ka me ye kpa be chere oni yevure kpare ori ewure kpare mo odlaba neti be miere ni ai boe be hire ye de bie mo oke yeye imeye mkune ke ndam bomode na mkire ke mo oke ya be se mo odimo oke ye wo ye sanwo awe biara semna kpare bi ani nzure ma olesin fa na fa wo sanwo wo sani avili ni amuati ye kabafre ya ye mawre amuati oke wo nre kpare osanke ohia na ye dokwa ye papa nwe yi ne boy mo oti anwo imale kabafre ya hand sanitizer oli ayire bie mo beye na onwo hia kpare elke biara maka hona ebe unke bele bi woken fa enwere ibi fa yes anwo mure ti elke biara esavini elke biara maka hona mpo chere emeye mo otia ensan o se be ma ye bogwa na ye ni meni yi a osanke kan ye nwi ke ewure ni bi ebe via wenu na yaga edo no kun neti oya be me bo na eni awie bobo eni lebo nuru anake ngohabo oke bo na abasa ke yenwa ela ba evri ama se bia ni de bie wo komza na bo wa anake de bia ya ngu ahiri ni anyu imeti dukwa eka bie be se oya ye bia hada ye buin oni yerua ana se enne bie bobo a ndie ndike duku ale bie bobo a ekura efa wa hankete na de bie efa eyen kemo oke eyeya na team serebe akibe se yedina suonu ayo bi ala yedina suonu sanke se enne de bie yere wo alienwu a mako elke biara sanke ko Kenya ye eyevura ika oni obayiya na oni waga suonu oni obasuonu a neme edo wala ni leti mpa be chere yes ewo suonu na enwuke ende kpoke enwuke biani de bie hakumza ama engura bobo endinde ana engura enie wonwumle kama okedi wonwumle mpo chere bevle na a doctors ana nurses mo bezi la high age man ba rana ba ria wo suonu neti eninyani enuni be bomode na beye na mo mfambu kanwre mamle Christian neti owokaye ya ason be miye ya ason yezele na nyamle mo odaye onwu de be biara odaye oba ahra ya boye hu ban aviza za high ewure mo le baki neti yesele na nyamle ke oyiraye odaye waslen ona halen ona sunsun wenza ne adumanu yo ndaba ase.
The Catholic Archdiocese of Accra, through its Caritas office, recently donated PPEs and other materials to 4 Catholic health facilities within the Archdiocese. Catholic Digest now brings you the sights and sounds.
As part of measures to curb the spread of the COVID-19 pandemic, the Catholic Archdiocese of Accra, under the leadership of Most Reverend John Bonaventure Kofi, CSSP, presented PPEs to 4 Catholic hospitals within the Accra Archdiocese, namely St. Andrew Hospital, Kodiabe, Immaculate Heart of Mary Clinic, Koleodo, St. John of God Hospital, Amanhia, and the Bator Catholic Hospital. Reverend Father Newman Tetefio briefed the gathering on items to be presented to the 4 hospitals.
So in all, we have these items to be presented. Hand gloves, 55 boxes. Sanitizers, 120 gallons. Liquid soap, 60 gallons. Dettol, or disinfectant, 60 gallons. Parazone or bleach, 60 gallons. Surgical mask, 60 boxes. Veronica buckets, 6 pieces. Receptacles, 6 pieces. Tissues, 300 packs. And face masks, 150 pieces.
In his address, Archbishop Bonaventure Kofi urged all to remain united and be responsible for one another in order to fight the COVID-19 pandemic.
I'm glad that the generosity of our people has made it possible to get these items that we are going to distribute to the various hospitals in the Archdiocese for your functioning. My grace goes to our donors. People have shown such love. I keep saying that we cannot continue to rely on outside support. We as church, we as people of Ghana must look within ourselves to see how much we can be of help and support to one another, because the era is gone when we are all the time looking outside. Let help come from outside. Now, we here must be able to generate this little support and put them together to help one another. Quoting Mother Teresa, as you know, he says, if you cannot feed a multitude, feed one person. And I think that's what must be our mode of work. And so we want to use these items to help the few that we can meet. It's not only Accra Archdiocese that is doing this. So many dioceses in Ghana, all the dioceses in Ghana, they are also having programs to help the hospitals, to help the needy. As Kumasi is doing it, Tamale is doing it, Bogatanga is doing it, Wa is doing it, Koforidua is doing it, Ketakachi is doing it, Cape Coast is doing it, Ho is doing it, USU is doing it, all the dioceses, Interquare is doing it. And so all this, if you put them together, become a big thing. And so we want to say thank you to all who contribute to make the church function.
He later presented the items to the representatives of each of the 4 health facilities available. Catholic Digest interviewed a couple of health personnel present at the gathering.
I want to assure everybody that these items are going to be used judiciously and to the purpose for which it's been given, so that at the end of it all, both staff, patients, relatives will all be grateful to God for what has happened today. And so to the Archbishop and to all the priests, we say thank you and God bless you.
The government is doing its bit to supply as many as they can within their capabilities. But speaking about Koleodo, for instance, where we work, that help has not come. So we are grateful to the Catholic Archdiocese of Accra for the donations that they've made to our facility in particular. And then we are also pledging that whoever can offer us the support that we need, we'll be very happy to receive them for the betterment and the safety of our patients and ourselves.
You are welcome to the interview session here on Catholic Digest TV program. We have in our midst a councillor who is the vice president of the GNACC. He will tell us more about it. He's here to tell us more on healthy issues concerning COVID-19 and the way forward in terms of counseling. Mr. David Ulaga, you are welcome.
Thank you very much, madam.
Who are the GNACC and how long have they been in existence?
Okay, so GNACC is Ghana National Association of Certificated Counselors. It's a group that had been established, registered with the Registrar General, a group that can sue and be sued. They are professional counselors who have come together to work on professional development and the welfare of its members. You must know what counseling it is. You must go to school. You must study the ethics of counseling before you can call yourself a counselor. So we have come together as professionals, people who have read counseling, in order to build that capacity, in order to help one another, to provide the necessary training. And the good thing for GNACC is that our country is divided into zones. So we have a zone like what we call Vega. Vega comprising Greater Accra, Eastern, and Volta. We have Bash comprising Ashanti, and then Bronga have Western and Central, and we have the New. New is the 3 northern regions, Upper East, Upper West, and then the northern regions. Now we have the 6 other regions that is being constitutionally added to the 10 regions. So this year, GNACC is going to have our AGM, and then we will trigger our constitution so that we can add the other 6 regions, so that we can now take care of all the 16 regions that we have in this country.
So what form will the general public benefit from your services, taking into consideration the COVID-19 pandemic?
Okay, so as it is right now, the only option or strength that we have is cyber counseling. You see, traditionally, counseling is done, it's a face-to-face affair. I see your face, you see my face.
Yeah.
Then whatever your problems might be or issues might be, I could help you to resolve your problem. But in the midst of COVID-19, where you can't come to my home or you can't come to my center, I can also meet you anywhere. The only strength we have now, or the only bridge we have now to work on, is cyber counseling. And cyber counseling is basically the use of internet. It's an online service. So we are talking of WhatsApping, we are talking of chatting, we are talking of voice messaging, we are talking of video calls, anything online that would not have to be so much of a problem as far as distance or barrier is, it might be a problem. So these are some of the avenues by which we are helping our clients as well as Ghanaians. In the midst of COVID-19, I must add that we are not only providing services to our clients, we have opened up to anybody in this country who would need our services.
For free?
For free. You don't pay anything. All you need to do is just get your mobile phone or whichever form and load it with credit. If you are somebody who can read, we could do the chatting. If you cannot read and you can do a call, you call the person who is supposed to be your counselor or whose numbers are available, and hooray, you are good to go.
Will the service end after COVID-19?
Yes. And in fact, we have some of our counselors right now who have their clients outside the jurisdiction of Ghana or outside Accra, who might not come to Accra almost every day to have their services provided. And these people do the online or cyber counseling. Even after COVID-19, they will still go ahead and provide their services or render the services to those people.
So how unique is your service compared to general counseling?
Very unique. Extremely unique. See, GNACC is just about 3-4 years old, right? But we are all over the country. GNACC is an organization that the interest of our clients is paramount. We have people in the Upper West region who are counselors and members of us. So all we do is connect the counselee or the client to one of our counselors and say, look, this person is in need. So why don't you connect and help? Again, for free. Under normal circumstances, counseling services are to be paid for.
So your last words to the public.
I will comment from GNACC, and then come to the national. GNACC, if you're asking me, is the last stop now for counseling profession and counseling needs. If you are in need of a counselor, just check the numbers on your screen and we'll render professional counseling services to you for free. Now, in the midst of COVID-19, I will say that your life is in your hands. Let's admit and let's appreciate that COVID-19 is here with us in Ghana. The environmental and personal protocol that we have been given: wash your hands, cover your mouth, observe social distancing, and whatever you think will promote hygiene so that you don't get the virus contracted, please do it. And at the end of the day, you'll be fine. But in case you have contracted the virus, fall on GNACC and you'll be even stronger than before. God bless you.
To you out there, indeed, your life is in your hands. Stay safe. Thank you for watching.
Christ,